Lucky Stars, Nicole the cat mommy here at 28 and a half weeks pregnant. Now, instead of doing a garden variety pregnancy update, I am actually going to show you exactly how I do my home blood glucose testing. Now, I am a novice myself. I just kicked this off yesterday as I had my diabetes education session at King Edward's Hospital in Subiaco, Perth, yesterday morning. So bear with me here, but I do feel like I'm getting the hang of things and that it's going to be easygoing from here, even though it's not the most pleasant aspect of pregnancy. I am feeling very optimistic, and this education session was really positive and encouraging, and it left me with a sense that I can manage this, and baby girl and I can have the best, healthiest possible outcome and still have that natural water birth that we've been dreaming of. So here we go. So what it comes with is the meter. All right, that was my iMessage on FaceTime. The Lancet system. So I will show you how to implement a Lancet into here. It is cleverly hidden, which makes it less painful and also not as frightening because you don't even see the needle when you're putting it up against your finger. And the pack of test strips, plus the 10 Lancets themselves here. Sharps bin. So as soon as you start a new day, or you can do it, of course, the night before, once you finish your daily readings, you dispose of your day's used Lancet safely in here, which does not go in the regular trash. Around here, I know you can generally take it to the pharmacy and they will accept it, and then you actually have to buy a new Sharps bin, but that's once it's full, and you can see it's quite a lot of room in here. I have my, it's not a book, a log papers. So you see you have the date on the left, you have before breakfast, which is your fasting in the morning, 1 hour after breakfast. There are women who do test 2 hours after meals. I am a 1 hour tester. Then 1 hour after lunch and 1 hour after dinner. And then there's a comment section in case there were any anomalies, if you want to describe if you were feeling ill or there was any sudden change that could have caused such an unusual reading. Yes, and you do also need tissues handy to stop up that teeny tiny drop of blood that's going to come out, as well as wrap a test strip inside of it and then safely dispose of it in your trash. So, to begin with, you need to make sure that you thoroughly wash your hands with a simple non-alcoholic soap. So hand sanitizers are really out for the count here. So make sure the soap gets completely off and then thoroughly dry as well. Once your hands are completely dry, a trick I just learned from my sister-in-law who had GD recently before she gave birth to her baby, totally fine now, taught me is that you do want to have your hands warm. Now, I generally have cold hands, and that means my circulation is not the greatest. So before you set up to prick, all right, I am choosing this finger. They recommend these 3. I have to do it 4 times a day though, so I'm also going to throw in good old thumb here for posterity. So I'm using my left ring finger for my post-lunch reading here. So I am rubbing vigorously from bottom to top to bring, obviously, the blood flow as far to the pad as possible. You don't have to do this too long, and you'll be able to feel once you're nice and toasty. I think that should be fine. Now, I do have my daily lancet already set up, so it's under this cap here. Now, this is the lancet, and this is how you take it out. So it has a top on it when you get it, as you can see here, which you just twist off. It takes about 15-20 twists. And then you place it like so. Make sure to push it all the way down. And you push the spring down and you can hear a click, so it's loaded. Ready for pricking. Yes, so that is good to go. And when it's a new one, you have to twist the cap off. And then you put this lid back on here. Okay, now if you're using it for a multiple time that day, or you did not hear a click, what you need to do is pull this back, make sure it is loaded. Okay, it's already loaded, so you won't hear a click here. Now, I'm not sure if you can see, but there are numbers on this one. It's 1 to 4, which judges the depth of penetration. Now, they recommend to start at 3. 4 is the highest, so it goes in the strongest. 3, Barack. 3 should absolutely do the trick. Now, many people can get away with only 2, but it's suggested to at least start with 3, because just in case with 2, you don't happen to get far enough into the skin, you're going to have to prick again. Yesterday, I had to do that when I gave it my first whirl after lunch here at home 5 times, but it's because I was flinching. Oh my goodness, sorry. Barack is not getting enough attention. Yes, so do start at 3, and you just use this dial on the side. So you see, that's up to 4. Oh no, scary time. Let's go down to 3, much more comfortable. Okay, so that is ready to go. First, you want to set up your test strip in the meter. Now, butterfly is up, little points are facing out, this top part goes in. Push it in, you can see drop of blood is splashing, so that is ready to go. Again, since it's been a couple minutes, I'm going to quickly massage my finger like so to make sure the blood is flowing all the way up there to the tip. Get these lancets out of the way. Now, so this is the hole. This is where the lancet is very quickly going to pop out, but you will not see it because you will have it pressed up directly against your skin. So for those of you who are terrified, unnerved by the thought of doing this, like I certainly was, you can't even see it, and it's really, really quick. Okay, so you press that up. You want to go along the side, not directly facing into the pad because it hurts more. So you want to go along the side, not too close to the nail because the bone is right there. So you still want to get some padded cushion. So press, get the hole directly there. Now this button here, right under the number, okay, it's loaded already. We heard it click. You're going to make sure you keep it pressed firmly and you do not pull away. All right, you don't want to have to do this again. So let's get it on the first try. All right, here we go. Ay. It's not too bad. Oh, look at that. That was a really good one. Putting on a show here. Okay. You don't want watery blood because it will not, oh my goodness. I am bleeding like a stuck pig, which is a horrible expression for a vegetarian to use. If the meter goes off in the meantime, just press M again and then you see the flashing. All right, again, you don't want the blood to be too watery because it just will not sense it. Ooh, sorry if this is a little graphic for you. But don't worry, I'm fine. So you want just the side of the point in the blood flow. You hear a beep. It has sensed it. Okay, I am going to cover this up. So, see how snappy that was? That's a 5.5. That's in millimoles. Where you live, you might have a different measurement system where it's more around 100. So, after a meal, 1 hour after a meal, what you want, well, as someone suffering from gestational diabetes, is to be below 7.4. Now that is well below, not too low though. So it's very comfortable. So we gotta give a thumbs up for my lunch choice today and the way my pancreas is managing the glucose and the insulin here. So very happy with these results. All right, now making sure that this blood is all gone. I don't want to gross you out or have any fainters here. But when you clicked on this video, you knew what you were getting yourself into. This is a live demonstration. This is not an act, and oh my goodness, Baruch is going crazy right below, chasing his tail. Just did the cutest dimple. He's trying desperately to get my attention. Okay, so that is fine now, all mopped up. So now I make sure to note my results 1 hour after lunch, 5.5, which is actually 1.1 less than after breakfast. But breakfast I had waffles with a bit of maple syrup, so it makes sense that it would be a bit higher, but still well below the healthy limit. We're rocking this, and you can too, I'm telling you. And if it doesn't work for you, it's not your fault. It just means you might need to try another way. So you would have to talk to your caretaker about that. But don't blame yourself. Don't be hard on yourself for that. But for most of us, we can manage this through diet and moderate walking exercise throughout the day. So here we go. I'm going to remove the test strip, wrap it up in the tissue, and dispose, and then put everything away in my handy little pack here. And go on with the rest of my day. I have one more reading to do 1 hour after dinner, but until then I can relax and enjoy the rest of my day. So I have to do this for about another 2 weeks until I see my midwife next. And we're going to review all of my readings and cross our fingers that I keep rocking them and that they're all at a healthy level, so we can reevaluate and say, how about we take this down a notch and just monitor every other day. So I hope it works out like that, but I am confident that it will and that I can totally manage this, and this will not be a problem for baby and I, or for the birth outcome that my husband and I have been dreaming of. So I wish you all well in your management of gestational diabetes, and I know you can do it too. And if just dietary management doesn't work for you, don't blame yourself. It is not your fault, and don't be too hard on yourself. It's just those dang hormones in there that are messing around with your body, and you will get over it. You will find another way to feel better and have a safe outcome for you and baby. You just have to talk with your caregiver about what step to take next. And for those of you who are fearful of needles, like I always have been, I actually have childhood trauma from pins and needles, and I'm handling this like a boss, so I know you can too. It's really not that bad, and it's temporary. We will get through this together. So if you would like to continue following me on my pregnancy journey and also how I manage my gestational diabetes, please subscribe, come along with me. And if you're also dealing with the same thing, let me know in the comments below how you've been handling your diagnosis and treatment. And give a thumbs up as well. We love support and encouragement here. We need to be a support system for each other so we can all feel like we can get through this together and have the best possible birth outcome for ourselves and our precious little babies. I know we can. So keep up the catitude, live paws to the wall, and have a perfect day and perfect pregnancy. See you in my next video. Thanks for watching.